So incisors. All right, the first thing that you're gonna look for, once you know that it's an incisor, is this maxillary or mandibular? That's the first thing. So is it maxillary or mandibular? And don't look at the size of them, because that is not a good indication. We've put some tiny maxillary incisors on there, and there's some gigantic mandibular incisors. So don't use size as the way to tell maxillary from mandibular. The way to tell maxillary from mandibular, in my mind, is looking for the lingual surface. Okay, the more concave, the facial surface will be the more sort of straight, flat, or slightly convex surface, and the lingual surface will be the more sort of curved surface. If there is any sort of, if there's the absence of any anatomy like ridges, marginal ridges that are pretty obvious or whatnot, it's a mandibular. So sort of a blank lingual surface is mandibular, okay? So this is the lingual surface. If it's blank, it's mandibular. And if it's got any sort of anatomy to it, that's the lingual view, that's maxillary, okay? Now, as you're looking through your jars of teeth, you'll notice that some of the examples in there are not really good because of tooth wear. That's the primary thing. A lot of these things, you'll be like, well, I was looking for that and I didn't see it, or, you know, and it's usually because it's worn down. On the tooth ID exam, Dr. Fry is going to give you teeth that will not be so worn down that these key characteristics will be very obvious, okay? Now, you may have to like really be very good at using your decision tree, but you'll have enough factors where it'll be pretty clear what the answer is, okay? So does this make sense to you? You flip it around to the lingual side, you know this is an incisor. If it's like a blank slate, there's no obvious ridges or cingulum or anything on the back side of it, it just looks kind of smooth, then it's probably mandibular, regardless of the size. If you can see those marginal ridges and then this little sort of area where it sort of does this thing with that nice distinct fossa right next to the cingulum, then it's probably a maxillary, okay? So that's the first thing. All right, so once you know if there's maxillary and mandibular, then we're gonna branch off. And now we're gonna tell the difference between centrals and laterals, okay? So I'll do this for the mandibular first. So the next step is central versus lateral, okay? For this view, you need to turn it and look at it from the incisal. So you're looking down the edge, the cutting edge of the tooth. So this is the incisal view, okay? Okay, let's see if I can do this. Okay, so this is the incisal view. And so the central will look very symmetrical from the incisal view. It's very symmetrical. So pretty much that edge, incisal edge, has a very balanced arc to it. And then the cingulum, which is, you can sort of see from this view, is centered right in the middle, okay? Contrast that, so that's the central, the lower central. Contrast that with the lower lateral. If you were to draw a line from the distance middle, from mesial to distal of that incisal edge, it would look asymmetrical, it would look unbalanced, it would look lopsided. You would see two things that would really contribute to that lopsidedness. You will see that one of the corners, one of the line angles on the mesial or the distal will be curling back towards the lingual. And you'll also see the cingulum offset that same side that the corner is curled back towards. Okay, so it's going to be lopsided to one side. So that's the lateral. Okay. Okay. Does that make sense to you, at least theoretically?
Mm-hmm.
Okay, so mandibular incisors are a blank slate. They're smooth on the lingual surface. That's how you know it's mandibular. To tell whether it's a central or lateral, look at it from the incisal view. If it's symmetrical and perfectly centered, then it's a central. If it is lopsided, if one corner is curled back to the lingual with the cingulum also sort of leaning towards that side, then it's a lateral. Got it?
Mm-hmm.
So now that we can tell a lower central from a lower lateral, the last step for determining which tooth it is determining left from right, correct? There's going to be a left and a right version of each of these teeth. For the lower central, because they're symmetrical, it is practically impossible to tell the difference between a lower left central and a lower right central. So we won't ask you to tell the difference. We'll ask you to answer with a catch-all. We'll ask you to write 24/25. Okay, you cannot tell the difference, okay? So it's automatically going to be 24/25. Okay, you can't tell the difference. On the lateral, you can tell the difference, and it's that lopsidedness that tells you the difference. Whatever side of the tooth it's lopsided on, that is the side of the mouth that it's on. So actually this example right here, it's lopsided towards the left. That's a lower left lateral, okay? Okay, so for this, whichever side that it is bent, that corner is bent towards and the cingulum is going to, assuming that you're looking at it from this perspective with the facial being this way and the lingual being this way, that's what it is. So that's a left. The right would be a mirror image of this. It would be curled back this direction with the cingulum towards the right. Does that make sense to everyone? Okay, that's it. I mean, that's all I got for the lower lateral incisors, or the lower incisors period. We cool with that? All right. Let's go to the maxillary. So the maxillary incisors. Of all the incisors, I think the maxillary incisors telling central from lateral can be the trickiest at times. You know that comparison-wise, most people's lateral is going to be a smaller tooth than the central, but again, sometimes he'll put relatively small centrals on the tooth ID, and then we'll find a really unusually large lateral and it'll be on there, okay? So here's how we tell, once you know it's a maxillary incisor, how we tell central from lateral, okay? And it has to do with the proportions, okay? So looking at it, you can look at it from the facial or the lingual view. That when we compare the incisal gingival to the mesial distal dimension, the mesial distal dimension compared to the incisal gingival on the central is going to be wider than that comparison on the lateral. So it's kind of like, to use a crude example, if you were to stand me and Dr. Fry next to each other, we're actually about the same height. Okay, so you can't use our height to tell us apart. But our width from mesial to distal is a little bit different, okay? So he's a central and I'm a lateral, okay? And you need to look at lots of examples of these, but you'll see that that ratio of height to width is pretty consistent. The centrals have that wider width compared to their height than the laterals. That's how you do it, okay? That's how you tell a central from a lateral. So, Then once you know whether it's a central or a lateral, how do you tell left from right, okay? And the secret to this is finding out where the mesial, where the distal is, okay? So for both of them, it's basically the same rule. And I'll try to be really, I'll exaggerate this so that it's really clear, okay? So we're looking at the, what are we looking at here? If you look at the incisal corners of any maxillary incisor, whether it be lateral or central, the mesial incisal corner is going to be more square. It's going to be, more square. And in fact, that little point up there will be more incisally located because of that squareness. Okay. Contrast that with the distal incisal, which will be more rounded, and as a consequence, its little distal incisal point is a little bit lower. Okay. So when you hear those things in the lecture about the distal margin being a little bit lower, that's just the other side of that same coin of having the curved corner versus the straight corner, okay? So whatever version of that clicks in your mind, it's basically variations on the same theme, okay? So you're looking for that more square corner versus the more rounded corner, and that will usually tell you which one's mesial. The square corner is mesial, the curvy, more rounded corner is distal. Just orient it correctly so that the mesial towards the mesial, and you know left from right. Does that make sense to everyone? Okay. So those are the incisors. So those are the easier ones in the anterior region. We'll move on to the bane of your existence, which is basically the canines, and they will continue to haunt you for the rest of the semester. Okay. So I'll leave this up here again, like before. You can come up here and take a picture of it, post it to your Facebook group, whatever. Okay. All right, canines. Okay, so again, we'll do the same thing. The good news is that there's only like one type of canine on the maxillary and one type of canine on the mandibular. So there's not a central and a lateral canine, they're just canines, right? So we have to go through that exercise of figuring out those things. So it's only going to be maxillary versus mandibular, and then right versus left. That's what you got to figure out on these, okay? All right, so let's try it. So for canines, the first cut is going to be maxillary versus mandibular. Again, do not look at the roots. Don't do it, okay? You're going to be tempted to, but don't do it. All right, so. Max versus mand. There are really two big ticket things that separate maxillary from mandibular canines, okay? And I would encourage you to look for a combination of both of these. The ideal scenario is you're able to check off both of them, okay? But at least one of them will be very clear, and then the other one will be kind of like, yeah, if you sort of like use your context clues, it'll make sense. So the first thing that gives me a clue is just looking at it from the facial view, okay? And looking at the contour, okay? The contour. And what I mean by that is sort of the outline, okay? In general, as you look at sort of the way this crown is shaped, this is a facial view. Mandibular canines tend to have a bit of voluptuousness to them. I guess that's the best sort of like comparison word to use, versus the mandibular, which tend to be very slender in appearance, okay?
Dr. Fry is a maxillary.
Right. And I'm a mandibular, okay? So that's your first hint. It's not definitive, But when you look at it from the facial view, your first thing is, okay, if in my mind, is this more sort of voluptuous or is it more sort of slender? Okay. Okay. If it's more voluptuous, you're onto something. Maybe it's a maxillary. If it's more sort of slender looking, maybe it's mandibular. The clincher is when you turn it sideways and look at it from a proximal view. Okay. So looking at it from either the mesial or the distal, I don't care. Just make sure you know which side you're looking at, know which side's buccal, which side's lingual. Okay. Okay. So if you look at it from the proximal view, so this is facial, that's lingual, okay? And you were to draw an imaginary axis line centering on the long axis of the tooth, that cusp tip of a maxillary is almost always going to be slightly facial of that imaginary axis line right down the middle, okay? Sometimes it gets really close to it, but it's still just always a little bit buccal or facial of that imaginary line. Contrast that with a mandibular. If we were to draw the same imaginary line centering on the long axis of the crown of that tooth, so it's facial angle, its cusp tip will this is even more definite, it'll always be lingual of that imaginary middle line. So it's always curving back. And that kind of makes sense when we think about it. If your occlusion is correct, or at least generally functional, your maxillary facial surfaces overlap on the facial side of your lower teeth like this. And so when you bite down, your maxillary canine should be out in front of your mandibular canine. And that all makes sense. Remember those curves that you're memorizing, like the curve of Spee and curve of Wilson and the curve of Monson, spear of Monson, whatever it may be. This all fits together. In order for this guy to go out front, it's been engineered to be slightly tilted outward like this. And the lower guy, in order to fit nice behind the upper guy, is curling back a little bit to fit in it, okay? If it were the opposite, we'd be in for a disaster because they'd be banging into each other all the time. And that's why people with malocclusion end up destroying their teeth, because we have things that are sticking out in areas where there should have been a escape pathway, okay? So from a functional standpoint, the goal of orthodontics, beyond the aesthetics of straightening your teeth, more importantly, it should be to align our teeth such that we have correct occlusion, okay? All right, does that make sense though? So these two factors, you get your first hint from the sort of outline of it from the facial view. More curvy, more voluptuous, wider mesial to distal is probably going to be a maxillary, but you're not sure yet. More narrow and straight mesial and distal sort of contours is going to be a mandibular. Then for the clincher, you turn it sideways. If that cusp tip is leaning just buccal of that imaginary line going down the middle, then it's almost certainly a maxillary. If it's curled back like this, then it's definitely going to be a mandibular, okay? All right. Then how do you tell left from right? For the left from right, on the maxillary, the key is that voluptuousness, okay? I did a really poor job. This is not really, so I can do that a little bit better. Okay, yeah, okay. All right. So these things all sort of work together. This is a facial view. So this is mesial right here, and here's distal, okay? So it'll have its mesial sort of incisal point angle is going to be higher than the distal incisal point angle. And this is true for almost every tooth. I can't think of really any exceptions to that. But really significantly, we talked about that voluptuousness. The thing that makes it look voluptuous is that a key characteristic of maxillary canines is this big sort of convexity on the distal surface. So this distal height contour really sticks out quite a bit, okay? And it's sort of in maybe middle to junction of middle and incisal thirds is where that sticks out, okay? That's your clue. Where it really sticks out, the side where it really has that sticking outness, that's the distal side, okay? Now you know mesial from distal, you can tell left from right, okay? For the mandibular, this one's always a little bit more subtle, but it has to do with those incisal point angles, similar to the maxillary in that sense. Okay, so, and here's that pattern that we see throughout, that mesial incisal point angle is going to be slightly higher, more incisal than the distal incisal point angle. So as a result, that entire mesial surface is going to be slightly longer than the distal surface. Okay? I guess another way of saying that is that the mesial cusp ridge has the appearance of being a little bit shorter than the distal cusp ridge. But I would go with that sort of point angle. Whichever one looks a little bit lower, that's the distal side. Does that make sense to you guys? Okay. As you begin applying these, it'll just become like, oh, okay, I'm seeing that, I'm seeing that. Oh, I can see why this was a bad sample because it's all worn down and it doesn't give me that data, okay? So if you get one, you're like, oh, I was not expecting this to be the answer, it might be because that tooth is worn down. Now, if the tooth isn't worn down and it's just totally intact, then you don't know your rules well enough. But there are a lot of worn down samples in there, okay? So this is it. This is what helps me to survive these sort of exams, okay? So I'll leave all this stuff up here.
That's it? Okay.